So I'm going to talk about telehealth, and if I can find it. Help. It's a good start. Yeah, you don't have to be IT literate to actually run video consulting. I've got used to an Apple Mac and I'm hopeless now with Microsoft. Here we go. So how does it work and is it right for me? So I thought I'd start with just an introduction about telehealth. So the terms telehealth and telemedicine are used interchangeably. And generally people, when they're talking about telehealth, they're talking about the multidisciplinary team using video to talk to patients, whereas telemedicine seems to be more doctors and specialists talking to patients. The term telemedicine itself was first used in the 1970s, and it literally means healing at a distance. Other definitions of telehealth/telemedicine include the practice of medicine when the doctor and patient are widely separated, using two-way voice and visual communication, as by satellite or computer. The delivery of healthcare services, where distance is a critical factor, by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interests of advancing the health of individuals and their communities. That's the World Health Organization. You can always rely on them to give you a comprehensive description. So a short history of telemedicine. It can be first traced back to the mid to late 19th century. One of the first published accounts of its use occurred in the early 20th century when ECG data were transmitted over the telephone. In its modern form, it began in the 1960s, and early examples included the use of television to allow consultations between specialists at a psychiatric institution and GPs at a state mental hospital, and expert advice from a major teaching hospital to an airport medical centre. And although I've got the Jetsons up there, it wasn't those that did it. It was actually Massachusetts General Hospital giving advice to Logan Airport over in Boston in the United States. There's also a lot of accounts of, telephone triage to sailors. So types of telehealth, so the places that it tends to be used is a specialist to a patient in their own home. So the patient has their own computer specialist in their office, and they can do an appointment rather than the patient travel all the way into the clinic. A specialist to a patient and GP. We've had a few of these, mainly because there's been logistical issues with bandwidth for the patient. Typically, we at the Alfred tend to use the specialist directly to the patient in their own home. But the specialist to patient and GP works really quite well for complex patients, especially when they need to have blood tests done. Perhaps we've got patients who live in Horsham, about 4 hours away, so they can easily go and get spirometry done at a local place rather than travelling all the way to Melbourne for what might end up being a 15-minute consultation with the doctor. And as you all know, it's a lot of time, it's a lot of effort, and it's actually quite expensive for patients to do all of that travelling. And we costed that out in one of our studies, and I think the average saving was about $297 for each telehealth consultation. And also specialist to specialist. So this tends to be more when there's a pediatric patient is going to transition to an adult centre like we do in Melbourne, where they're not in one single hospital. So the Royal Children, one of the physicians might actually do a video conference with one of our specialists just to discuss the patient, especially if they're sort of bordering on needing a transplant and are quite complex. We also have specialists to community healthcare teams and the transition clinics themselves. And we have done, I think, at least one where we've had a specialist at the Alfred and the rest of the team have travelled over to the Children's to do the clinic. And as you know, it's quite time consuming. It's at least an all morning affair. And to have a whole team travel to another centre is time consuming, and it's not really cost effective. So how does it work? And this is actually from 1924. So they were already talking about the use of television and radio to do consults with doctors way back then. So it's not a new idea at all. It seems to have gathered momentum in the last 5 years. Certainly there are many countries around the world that use it now. Australia is one of the forefront of that. America, the US do use it, and so do the UK. But the UK, when they talk about telehealth, it tends to be more phone triage. It's not doing video consultations with patients. And in America, it's gathering momentum, but their problem is that they have so many providers of internet, and it's not often very good. So they're sort of hampered by bandwidth. So what is a telehealth appointment? It's an outpatient appointment using the internet and video rather than attending in person at the hospital. It involves the patient, their carer if needed, the specialist and other members of the healthcare team, for example, the physio, the dietitian, OT, social worker, and psychologist. And we actually at the Alfred offer consults for patients who have psychosocial issues, and many of them do. Instead of doing hour-long phone conversations with the social worker or the psychologist, they can now actually do a face-to-face consult using video, and it's much more effective. The psychologist or the social worker can pick up cues that they wouldn't get from just a phone call, and it's more helpful and more relaxing. So what equipment do you need? So for the patients, they need a laptop or a desktop or an Android tablet. This particular system doesn't work on iPad just yet. The management platform people who are Attend Anywhere, and they're working with Health Direct. They've been in negotiations with Apple for quite a while to get this system up and running, and Apple doesn't play very well with other people, so it's been a long process, but they're on the verge of getting this going on an iPad and iPhone, which will be absolutely fantastic. But it does work on an Android tablet. We've had patients, in fact I remember one memorable one, a young lady who was due to have an appointment with John Wilson at the Alfred, and when I got online with her, she was sitting in her car, and I said, "Oh, what's happening?" She said, "Oh, I've just been discharged. I spent the night in emergency." And I'm okay. She said, "Yeah, I thought I better keep the appointment. I thought John would want to know what was going on." I was like, "Okay, fine." So she did the appointment actually sitting in a car outside the hospital she'd just been discharged from. And we've had another patient who was at work, and he worked in a labouring capacity, and jumped in his car and did his appointment during his break. So it's really great, they can just sit there for 10 minutes, get in the appointment, speak to the doctor, any of the other healthcare team they need to, and then go back to work, and they haven't, taken a whole day out of their life to do that. You also need Google Chrome web browser. Now, previous incarnations of telehealth have used other systems, so sort of Skype or VidYO. That involved a download of that software, and that was quite problematic, and it involved me as the coordinator being on the phone to the patient, talking them through how to get it past their firewalls, how to install it. It took anywhere from 5 minutes for the incredibly tech-savvy to, I believe I spent about 70 minutes on one of them trying to get it installed. So this now is, it's actually built into Google Chrome. So you don't need to download anything except Google Chrome, and most computers, it's a free download. It's not an issue. Even on most hospital-based computers, they will allow it through. And I'll do a demonstration when I'm finished to show you. And access to the internet, preferably cabled, just for you get a better, not quality, but it's more consistent. But Wi-Fi is okay. And look, most people, and probably everyone in this room, have more than one device attached to their internet at home, and everyone has Wi-Fi. So asking them to cable, it's not really going to happen. And to be honest, it's not an issue anymore with the Google Chrome web browser. The quality is really good. So the process we use at the Alfred, the patient and the doctor negotiate whether telehealth is appropriate for them. And then I discuss with the patient about what equipment they need, what they need to do, make sure their computer is not 10 years old, that their operating system isn't sort of so clunky it's never going to work. Most people have used Skype these days, so they know their camera does work on their computer, or they play Spotify or whatever, so they know the speakers work. We arrange a day and a time, if required, to help the patient set up their system and try out an appointment. Or alternatively, I can actually just take them into the telehealth office we have and show them what they need to do. And sometimes they're a bit reluctant because they don't think they're very good with computers, but once they see it demonstrated, it's really quite easy. And we've got not CF patients, but bronchiectasis patients and other patients of John Wilson's in their 80s who have used it. And I think that's amazing, and they love it. So if they can do it, so can we. And then we organise with the clinic coordinator for an appointment time. The patients receive an email detailing the day and time of the appointment and steps for entering the appointment. And we send that out as a matter of course, but after a couple of times of doing it, the steps to get in never change. So they sort of know how to do it. They've saved it in their favourites, and it's very easy for them. They enter a waiting room, and a text alert is sent to the coordinator. So I get an alert telling me there's someone waiting in the the waiting room, and I also get a pop-up on my screen in my computer in my office telling me that there's someone there. So I would go into the waiting room and make sure there weren't any technical issues. So for instance, the most common one is that you can't hear what the other person's saying. So generally we'll just go through the steps to rectify that. And it's typically the first time they've used it, they have to allow the Google Chrome to use the camera and microphone of that computer. And once that's working, it's fine. And then I would usually ask, does the patient want to see the physio or the dietitian or anyone else? And if they do, while they're talking to the doctor, I'll go and arrange that. Sometimes they'll say no, and then I go out and see the physio who says, actually, I do want to talk to them, so I'll just pop in there quickly. Then I would follow up with the medical staff about what the treatment plan is, whether the next appointment is another telemedicine or whether it's going to be a face-to-face, or if they've got to have any scans or anything. And then a Medicare benefits email is sent to the patient after the appointment, just so generally in clinic it's bulk billed, and they used to sign a form. They don't need to any longer, but for telehealth purposes, they still actually need to give their consent for Medicare rebate, and that's done with a pro forma email, and they just send back one saying, yes, I agree. So is it right for me? Who can use telehealth, and how is that decided? We offer it to any patient who'd like to use it regardless of whether they are rural. So the criteria set down by Medicare is fairly strict. Patients need to be living in what they class as a geographically remote area, and they have 5 bands. The first area is metropolitan, and then area 2, 3, 4, and 5 are rebatable. We don't have anyone in the 5 and the 4, and we've only got a handful in areas that are classified as a rural area 3. And they are patients who travel, 5 hours to get to clinic. It's never used as a first appointment with the service, so we need to be able to see the patient first to build a bit of a rapport, and then it can be used after that. And it's used in conjunction with physical attendances at outpatients. It's not to totally replace them coming to clinic. Patients who come every 3 months, we would generally say, okay, we'll see you at the 8-week mark, and if you're well, we'll push your physical appointment out for another 2 months after that. If anything happens between then, they would normally hop on and do another telehealth, and we'll judge whether they need to come in quicker. And it's decided between the patient and the specialist, as I said before. What has telehealth been used for at the Alfred? So patients who are reluctant to attend the hospital and have fairly poor adherence to their treatment, we found that by offering this service, they see it as a less of an inconvenience, and certainly they become a little bit more engaged with the service because it's not such a difficulty for them to get there. It's also been very helpful for people who find coming to their appointments is financially difficult. So that's been great too. Patients who need more frequent attendances and are inconvenienced by distance. Patients who are end stage and prefer to stay at home and be cared for by the community medical team. And that's really important because not everyone wants to be in hospital when they're nearing the end of their life. And we did have a young boy who didn't want to be at the Alfred for that, and we were able to get him home. His GP was involved in his care, and they would have weekly discussions with the specialist to do the treatment plan, and he was able to die at home, which was great for him and for his family. Patients who need frequent psychosocial appointments, and it's can be used we've used it in conjunction with home monitoring equipment. And we did a study in rural and regional patients. So what we did was we provided them with blood pressure machines, scales, thermometers. If they were diabetic, we gave them a glucometer. What else did we give them? Spirometer. And they would do tests twice a week, and the results would come through on a program to me, and I would look for any out of value alerts. There was also a questionnaire asking them how they were feeling compared to the previous day. And if there were any alerts triggered there, I would give them a call and ask them how they were, what was going on, if they needed a consult. And we were able to get them a video appointment much more quickly than, if they had to wait for an outpatient appointment, or in some cases, they'll wait. If it's 2 months for the next appointment, they'll wait at home and then turn up at clinic quite sick and needing to be admitted. So this way we can circumvent that, and they can actually be seen and get home treatment started much quicker. And that's worked really well. And so thank you for listening. I'll do a demonstration of what it's like from a patient's point of view getting into the appointment. Where's my thing? So this is the website. Just typed into Google Chrome. Then you just click on the Join Video Consultation and choose a waiting room. Enter the name. continue. When you first do one of these, it does a test call, so it will go through a bandwidth check. It will go through, can you hear the sounds, can you see yourself, can you hear your own voice, and then you can proceed to this. And this is what you see once you get into the waiting room. And they've added to this music.
Thank you for your video call.
I'm not quite
Someone
sure
should
why.
be with you shortly.
I've told them it's awful. So we might do that. So just tell
Please
them
read the
if
messages
it's-
as they appear on the screen, and we'll play some music while you wait.
And then when it's all over, and that's it. Fairly simple. Thank you. Any questions? Or are we doing questions at the end? Questions at the end. Okay, thanks very much.